Good afternoon and welcome to Leading the Conversation. This is NAMI Northern Illinois' weekly podcast series. Today featuring Dr. Kevin Thomas, who will be talking on the topic of cultural sensitivity and generational trauma. I'd like to thank all of you for participating, especially um, since this particular session was scheduled a week or so ago, but because of weather, we had to reschedule. So it's our pleasure to have Dr. Thomas here, and we're glad that he was able to land safely and join us this afternoon. I'd like to read a little bit of introduction. Introduce myself. Uh, my name is Warren Boykin, and I am the Program and Outreach Coordinator for NAMI Northern Illinois. Uh, just a little bit about our mission. Our mission is to try and make lives more comfortable for people living with a mental illness and their loved ones in our area. NAMI Northern Illinois covers a four-county area in upper Illinois, including Winnebago County, where we are located. So, without further ado, a little introduction. Dr. Kevin Thomas is a traumatologist and a psychotherapist and executive director of State of the Mind Institute and the owner of Mentality Unchained LLC. He's a passionate mental health advocate, trainer, and consultant with a wealth of mental health knowledge. He's an Army veteran, ordained minister, mental health advocate, and an affiliate of the National Alliance on Mental Illness, NAMI. He's a proud member of Alpha Phi Alpha Fraternity Incorporated, and he is currently the clinical director for Lantern Therapy Services and the Beacon of Enlightenment, where he works as a marriage, family, and trauma therapist. Dr. Thomas has worked in mental health for the past 16 years, and he is a national certified counselor, licensed professional counselor, certified relationship specialist, certified clinical trauma professional counselor, certified relationship specialist, and certified in psychological first aid, PFA. Dr. Thomas has published research on does intergenerational trauma influence growth or fixed mindset among ethnic minorities. He is currently researching in the epigenetic effects of trauma on people of color. I could go on, but I'd like to spend most of the time uh, having Dr. Thomas speak to you directly. I know that's what you're here for. Um, just a word about how we do this. This is a webinar format. We have lots of participants. If you have questions, we would appreciate it if you use the Q&A function in at the bottom of your screens if you're on Zoom. Um, we will be addressing your questions at the end of the presentation. So without further ado, Dr. Kevin Thomas.
Hello, everyone. Thank you, Warren, for the introduction. I did not expect to hear all of those things read out. I think when you hear someone read out things that you've done and certifications and things like that, it kind of humbles you. It makes you really appreciate the work that you have done and the work that you have created within the community. So I hope you guys can hear me. I'm going to try to speak up as loud as I can. Again, hopefully everyone's computer is turned up where they can hear me. So today's topic is cultural sensitivity and generational trauma. And just this could be two different actual webinars because both of these subject matters are very vast and when it comes to information, when it comes to discussing the matters of culture and trauma. And so these things are very, very vast. So I'm going to briefly kind of introduce you to what they are and then some aspects of it that I think that is important for us to understand and to know. But by all means, this is not an extensive um, um, uh, webinar where we would go into deep detail, because I would, as a therapist, being able to provide safety for individuals when you're teaching matters of trauma and then also culture. It could definitely be one of the things that causes people to cringe up, because culture is a big thing in our country. Culture from a standpoint of ethnic backgrounds, racial backgrounds, as well as gender, and so on. And so I want to make sure that we're sensitive to that. Again, I always say this when I start any type of workshop or seminar, that, this is a safe space. This is a safe space for um, free from judgment, free from criticism. And by it being a webinar, it's kind of difficult to do that, provide that. So what we'll do is we'll continue to skim the surface of it, but there will be times where you can go deeper into these type of information. So without further ado, I want to really discuss how we can enhance our understanding and skills when it comes to effective trauma care. As more specifically, when we're speaking in terms of generational trauma and cultural sensitivity. And these are some things that I'll speak of, and I'll define them so we can have a better understanding. But also, a lot of things that I'll be speaking on will not be on the screen. So what you see on your screen is more of a baseline, so you guys can follow along with me. And so we'll continue to do that. So our training objectives for today, key learning outcomes will be, we'll define cultural sensitivity and the importance of how it's important in trauma care. We'll also understand the different types of trauma and their impact. And we'll explore the intersection of culture and general generational trauma. There is an intersection, and they kind of overlap. And that's something that we'll see throughout. That'll be a common theme. And so even if I don't speak of culture specifically, I'll speak of generational trauma, but also know that I'm speaking of both in terms of our webinars here today. And we'll learn strategies for providing culture sensitive trauma care, because it's vital of us, if we're teachers, if we're social workers, if we're administrators, or just common individuals in our community. We must understand that there is a level of cultural sensitivity that we must understand when it comes to different individuals. Is there no cookie cutter ways of actually dealing with some of these things, and from a cultural standpoint, and also from a generational trauma piece. And then we're going to address challenges and opportunities to integrate cultural sensitivity into trauma interventions. And I will say this at the offset, is that one of the things when you are speaking of cultural sensitivity and you're speaking of generational trauma, or just trauma for that matter, is that there will be biases that comes with that. And I would love everyone on here on the webinar to understand that we all have biases, whether they're unconscious, whether they're knowing, that we all have biases, but we have to come to terms and be an acceptance of those biases in order to continue to work forward in the transition of healing, and then also creating a mindset of learning and growing. So I want you guys to continue to focus on that and know that you will go into this with biases. So what is cultural sensitivity? And more specifically, let's think about it from a standpoint of your place of business, your personal life, and how you interact with people and social aspects. And so what is cultural sensitivity? Cultural sensitivity involves awareness, understanding, respect of cultural differences. That's one of the things that we want to really understand, is that we have to have a respect for cultural differences. We're all different. We're not the same. Even in your own culture, there still may be some differences. And it's about recognizing how culture influences a person, their experiences, their behaviors, and their needs. And we must understand that. And the first thing of our key aspects is that we have to be culturally aware. We have to understand that culture differences exist. It actually happens. We're actually different. We're not the same. And so it's okay to know that and be aware that cultures, you are different. You're not the same. Things are not perceived, they're not understood the same. So we have to understand that. One of the things as we go through this webinar, I want you guys to keep on your front of your mind is that it's okay to be different, and it's okay to acknowledge that you're different, because we're not the same. One of the bigger things that I get involved with when I hear or when I'm teaching and training on cultural sensitivity, I always get one person that says, I don't see color. Well, here's the thing. Yes, you see color. We all see color. It's okay that we're different. It's okay that you see that I'm a Black male and that you are of another race. It's okay. That's okay. But what's the biggest thing is that we learn from one another, is that we take what our culture differences are and learn more about them. That's where we have the cultural competency comes in, is that's the ability to interact effectively with people from different cultures. That's the biggest thing that you could take away from here, is that being able to be culturally competent to interact with people that are of a different culture. Everyone doesn't have to be the same. But the best part about it is learning about a different culture and how they interpret and how they compute things differently than you, and still being able to respect them and yourself as well. Cultural humility, that's another key aspect, which is just an ongoing process of self-reflection and self-critique. It's okay to reflect on who you are as a person, and also to critique yourself. Well, I may have not handled that situation correctly. That's okay. That's self-reflection and that's self-critique. Being able to say, when it comes to cultural aspects, that, hey, I did not understand the environment, the situation that I was in, because it was different than what I'm used to. And that's fine. It's okay for you to be able to have cultural humility, knowing and reflecting on yourself and self-critiquing. So, what is generational trauma? So, we're talking about cultural sensitivity, we're talking about generational trauma. Those things will overlap in some form. So, generational trauma, also known as intergenerational trauma, occurs when the trauma experienced by one generation is passed down uh, to the next generation through emotional, psychological, and even sometimes physical means. So, what grandmother used to do has passed down to what mom is doing. Now is passed down to what you're doing. And for the most part, I will say this, and I don't like to kind of talk too much about the negatives, but sometimes there are things that are passed down that are not beneficial or healthy for the person living in the current state. We can't use what grandmother used. We can't look at things uh, wholeheartedly the way grandmother did, because times are different. And so being able to understand those level of what they experience. But here's the historical piece of it, and we'll get into historical context of it, is that to know that your parents or your grandparents experience a thing and how it impacts you today. I think that is a great opportunity to explore heritage as well as upbringing and histories and traditions throughout the family. So understanding, let's talk about understanding the science behind generational trauma. There's this historical component, kind of what I just spoke about. I want to give you some examples and we'll talk more about it, but it includes like trauma caused by slavery, colonization, war, displacement, systematic oppression. Now, this right here talks a lot about a lot of cultural aspects that a lot of people don't understand, don't know, or some people really just avoid because it's a conversation that requires us to dig into some of the unfortunate things that have happened in our country. And so I've had the privilege of being in many circles and being around many people. And one of the most profound things I've ever heard was a person said that we have yet to be the United States that we say we are. And in turn, what happens is um, these yet to be United States have yet to live up to what it's built upon. And so these historical contexts and patterns have led to a lot of generational trauma that is still being displayed today. There's a psychological effects, and this is the biggest. This is a big part of it. Is that those historical contexts lead to psychological effects? What do you mean by psychological effects? Well, guess what? It highlights how unresolved trauma can change our and shape our attitudes and our behaviors and our emotional response when it comes to future generations. So not only does it have a historical component, but it also has a psychological, I would go back and say an ongoing psychological effect for future generations. And if in order for us to change and reshape and redetermine the outcome of our grandchildren and our great grandchildren, that we have to stop those psychological effects when it comes to us so we don't continue to pass that along. And then the last component, which is more of a scientific and more of a difficult concept to understand, is epigenetics. There is a epigenetic component that goes along with generational trauma. It speaks to how our environmental factors, including trauma, can be affected by the gene expression and be passed down. And so we have to be careful that a lot of these things can be passed along and can be affected through our gene expressions. So I want to make sure that you guys really understand. Again, this is a brief overview, and it goes very in depth. But with the time, we don't have the time to actually go in depth in all of these. But we'll touch a little bit on these, and as we continue to talk about these things, these are not indicative of every person that deal with generational trauma, but there are aspects and there are small pieces, remnants of these things that are happening that lead to bigger psychological implications. So what is trauma? So now that we talked about cultural sensitivity and generational trauma, just to identify, again, to continue to identify the aspects of it. What is trauma? What exactly is trauma? Everyone has these broad overview ideas of what trauma is, but the clinical definition of trauma refers to an individual emotional and psychological physical response to an overwhelming event or a series of events that disrupt the ability to cope. And in essence, what it is it's any event that causes distress on a daily basis in your daily function that continues to perpetuate itself and not only happens one time, but also can continue on that vein of experience. The first type of trauma is acute trauma. You think about it, acute trauma is from a single event. Like it could be a car accident, it could be a natural disaster, it could be a event that has caused a family struggle. It could be anything from a single standpoint. That's why it's acute, meaning one. It means that specific. It could be just a simple or one-time event. And then we have what we call a chronic trauma. Chronic trauma is just what it says, chronic trauma. Chronic means continuous. It's an ongoing exposure to a harmful situation like domestic violence. You know, again, I want to say this is a safe space, and if at any point someone feels unsafe, I hope that you have someone near you. If I can answer or can work with you through that process if you're on the webinar. But chronic trauma is harmful and a continuous exposure, ongoing exposure, like domestic violence and long-term neglect. And that could also, ongoing and long-term neglect can be from a child's perspective of being neglected from a parent, being neglected from family members. Even adults feel feel long-term effects from neglect. So I don't want to discount any population, any type of population when it comes to chronic trauma. Then there's the third one, which is the most, in my opinion, is the most damaging one, which is complex trauma, which is exposure to multiple events and experiences, often interpersonal traumatic events, especially during childhood, abuse and loss. So there's a sense when it comes to complex trauma, it's like a buildup. I guess the word complex can also be synonymous with compound, meaning that there are many, there are multiple, there's not just one thing. So in essence, you can possibly put acute trauma and chronic trauma, and you combine those, again, compound, you can combine those to be complex trauma, which is ongoing, could be a single, it could be ongoing exposure, also could be multiple, more than one. So let's get into a little bit deeper a little bit. So why is cultural sensitivity and generational trauma important in trauma care? I want us to really, really think about that. Why is cultural sensitivity and generational trauma important in trauma care? First thing is it helps us identify with behavior patterns. It helps us to understand reoccurring patterns of trauma in our families, in our communities, cycles of abuse and substance misuse. All of these things combine. So if we're not careful how we interact with people, if we don't identify patterns, or we're not able to identify patterns, if we're not able to be sensitive to a person, at this point, we're not being sensitive to any of their cultural experiences or their behavior patterns that they've experienced through the years. So it's very important that we understand, in order to prevent or to provide, to provide trauma care, we must understand how and why these cultural sensitive and these generational trauma aspects are important, because it helps identify behavior patterns. Cultural manifestations, which identifies how generational trauma may manifest differently in different cultures, groups, cultural silence, avoidance, reattachment of trauma. Every group will not experience trauma the same. They will not experience generational trauma the same as well. So if a person from a different race and a different age group experience trauma A, and another culture and another age group experience trauma A, they're not going to experience them the same. We just don't do that. That goes back to what I was saying earlier about us being able to see more than just color. It's okay to know and understand that generational trauma will manifest differently in different cultures, as well as different age groups, as well as different genders, all of those things. So we can't just treat one person, everyone the same. We just can't treat everyone the same. Everyone must be treated differently. So what I challenge you today is, instead of initially seeing color, try to get to know the person. That's the cultural sensitivity piece of it, and which goes to personalization. We have to make sure that even when we're treating, not only when we're treating, also when we're encountering people, that we're not interacting with them the same, as the last person we spoke to. That's the biggest piece of being cultural sensitive, is being able to identify each person as and who they are, not because I've just spoke to Joe, now I'm going to go and speak to Larry the same way. It doesn't work that way. You have to be aware. This goes back to our cultural competency. You have to be competent enough to know that everyone is different and they must be treated and approached differently. You cannot and you should not address anyone the same, because culturally you never know. You may even experience a different culture as African American and a Hispanic person. You cannot approach them the same because you don't know their cultural experiences or their cultural background. So at the end of the day, it's best for us to learn how to treat people as humans first, being able to address people and approach people in the best humanly way possible. Because if you don't, we'll find ourselves overstepping. We'll find ourselves also manifesting some negative connotation from us, that we're not culturally sensitive to the persons and the person that's in front of us, rather than treating someone the same. And at the end of the day, this also helps us with improved outcomes. From a clinician standpoint, this helps us to understand different clients' perspective. We more like we engage more, and it benefits us because now we've opened up a positive dialogue with our clients to where we can have a better outcome. And when we are in tune with the culture differences and learning more about their generational experiences, it also helps us to integrate all these different skills and approaches to meet the person where they are. And that's my biggest pet peeve when it comes to working with individuals. And I see clinicians not meeting the client where they are. And so that happens more often than not. Not to mention when it comes to dealing on a personal and a social level, a lot of people take those things, and a lot of clinicians, particularly, I can speak to a clinician because I'm a clinician. Most clinicians will use that same approach that they deal with people and outside in social and personal aspect, the, the same way as people in the office. And you can't do that. There's a different approach, there's a different sensitivity, there's a different outlook, there's even a different perspective you must have when you're actually in social settings and personal settings than you should be when you're in the office working with a client. In the office, you should be therapeutic. You should be therapeutic. You should be trying to meet them where they are. And in the personal and the social setting, you should be really trying to get to know the person on a personal level. That means that there are going to be some things that you do that you wouldn't do in the office, because it's not recommended that you open up the self-disclosure spout per se fully when you're in session with the client, because it really clouds the interaction in a therapeutic process with the client. So that's why it's important that we're sensitive to the culture and their experience with generational trauma when we're talking from terms of trauma care. Trauma care. So the impact of trauma. So these impacts of trauma is also will be the impact of the actual generational trauma as well, and we'll talk more about that as well. There are psychological effects, and what do you mean by psychological effects? It starts to affect the person from a psychological mindset standpoint. You develop anxiety, depression, sometimes guilt, anger, and disassociation. These are effects that trauma have on you. And can you imagine, though, going through a phase of dealing with generational trauma from the standpoint of what happened with your grandparents is still today 20, 30 years later affecting you to the point where you find yourself experiencing symptoms of anxiety and depression, even a sense of guilt, and more so anger as well when it comes to that. Hypervigilance, intrusive thoughts, and flashbacks. These happen all often. Now, be it as it may, generational trauma will not directly cause uh, the recipient or the offspring to have flashbacks of your grandparents' experiences. But there is a hypervigilance of people and places and interactions based off of the generational trauma experience. That person will be able to take on those as well. Intrusive thoughts, those are again individual thoughts that just come in intrusively and just take over. So a lot of times that won't be passed down, but the hypervigilance, we will tend to, if you're experiencing generational trauma, you will tend to be more vigilant of things and people and places based on your experiences of your forefathers or your grandparents. Then there's a physical effect as well. I don't know how many people understand that a lot of mental illness and mental health and mental anguish can be physically debilitating. It can affect you in a way that affects your physical condition. It can lead to chronic pain, fatigue, headaches, sleep disturbances, and gastrointestinal issues, and that's more of those serious issues when it's really affecting your body to those points. And they don't have hypertension on here, but that can come as a result of headaches, migraines, same things. Also, not just taking care of yourself. Those are those physical effects, not taking care of yourself. So again, those are the physical aspects of it. And the behavior effects, withdrawal, avoidance, trauma triggers, or self-destructive behaviors. Now, these right here, this behavior aspect comes very comes to a point of it's a very hard line, blurred line when it comes to the behavior because of something that your grandparent experienced can affect you behaviorally. It says that situation, that instance, that environment has been so prevalent, has been so in tune with your family makeup that it's caused you to withdraw from certain situations in your current life. It has caused you to avoid, to be triggered by, a lot of things, a lot of oppression, a lot of people, a lot of young people that have heard the stories, that have experienced their grandparents or parents dealing with some of these aspects of oppression, uh, will find themselves being withdrawn or avoiding current situations and current environments based on the experiences of their parents. And so these can be triggers. They can be trauma triggers for. These can promote self-destructive behaviors. And a lot of times individuals don't know where they come from. They don't know how they experience that, how it's now affecting them in their present state. And then a lot of times the forefathers or the parents and the grandparents, they don't come, they don't experience these, so their youth or their offsprings or their children can actually experience these. Sometimes it's just in them, who they are, who they become through the years, and now it's having this effect on their kids. And so this is the social and the relational effects, and having difficulty trusting and isolating and even having strained relationships. You can be in a relationship and not know that your behaviors based on your parents and your grandparents is a direct effect to how you treat people and how you are in relationship with people today, whether it's intimate or personal relationship. It all can culminate into having these social and relational implications of just not trusting people and getting to a point where you're in a relationship, you can't problem solve. You find yourself isolating or stonewalling or not being able to effectively communicate with someone else. So culture and trauma. So cultural context shapes trauma. You know, different cultures interpret and they respond to trauma in unique ways based on values, traditions, and belief. Everyone doesn't have the same value system. Everyone don't follow the same traditions and rituals. And so you have to understand that being able to experience it differently is okay, but also understand that it also shapes how we are interactive with our own trauma. And so that is very important and very vital to understand. So when we're talking about cultural sensitivity, especially in our workplaces, is that if we don't understand that people in our groups and on our staff have different values and different traditions and beliefs, then we tend to bump heads most often because we don't understand that they see it different. They interpret it different. If someone's having a conversation with the supervisor and it sounds calm, we interpret that as they're getting along. But what if someone is more animated in their speech with their supervisor? The first thing we think in our mind is that that person is angry or that person feels like they're frustrated or they feel slighted or whatever. But that may not be true. That may be just how they speak and how they interact in their culture, and they bring it into the workplace. And so we have to be sensitive to that and understand that it may not be what we see. It may be something totally different. It may be something culturally based, and it doesn't necessarily mean it has to be negative or bad. And so there are examples in some cultures, trauma just may seem as punishment or fate, while in others it may just be viewed as a test of resilience and other experiences. So we want to make sure that we understand when we're talking about cultural sensitivity, you have to understand that there has to be a cultural competency piece of that because you have to understand and be able to speak to different cultures. Everything is not the same. I repeat that everything is not the same. Expression of trauma, cultures may have different norms for expressing distress. What one culture might interpret as normal reaction, another might see as avoidance or suppression. There's this thing that has been built and has been created through our culture and our society and yet to the United States that says normal is one thing. Normal is one way. Normal is the right way. Normal is a social acceptable way of responding. Well, here's the thing. And if you guys haven't noticed and don't know, normal is not a your normal may not be my normal. How I experience and my normality will not be the same as yours. So we have to take that term and just dismiss it and disconnect it from our language because guess what? If you base another person's normal off your normal, 100% of the time you will be culturally insensitive. Let me repeat that. If you base your normal off of someone else's normal or someone else's normal off of yours, you're going to be 100% culturally insensitive because guess what? You're not giving space for that individual to be themselves and to be authentically themselves and original. Because what you're doing is saying, my normal, you should do it the way I do it. You should perceive it and interpret it the way I see it and interpret it. That's not the case. People see things differently. People value things differently. So it's important that we understand that to be able to express your traumas and your experiences in a different way is not indicative of you being a bad person. That just says that I express myself different than you, and it's okay. The caveat to that, though, is that we're trying to do the best we can to be present for the other person, to make sure that we understand them and let them know that we're going to be sensitive to their traumas and to their experiences. So what about the culture of sensitivity and generational trauma and the response? Understanding response. It's just that simple. Understanding responses. Cultural norms may affect how individuals express, cope with, or seek help for trauma. Think about that. Your culture may dictate how you express, how you cope, and how you seek help. If we're not careful, we would allow our past traumas, our past generational traumas to impact how we express ourselves, how we cope, and how we seek help. Here, point taken. Here, some people might internalize their trauma with aggression or acting out, while others might internalize it with withdrawing and silence. Now, here's classic case. If a person is not open to being vulnerable, if they don't feel safe, they may not express themselves the way that we think they should express themselves. So picture that happening in the workplace and not knowing how to respond to that because we don't have the cultural competency to be culturally sensitive to what that person is actually dealing with. Because guess what? They may be expressing it in a way that is totally not understandable or not acceptable in the workplace. But if we're culturally sensitive, if we're culturally aware, it would allow us to at least have some dialogue with that person to really try to meet them again. Here's the word: meet them where they are. So we want to make sure that we're understanding the responses of a person that may be dealing with trauma or any type of or generational trauma, but also understanding the cultural component that goes right along with that. And I'm saying all this to say is that in our businesses, in our communication with others, how we address people, how we approach people, we have to understand that there may be underlying cultural implications that causes a person to respond the way that they respond. If we can find a way to get past the fact that our physical appearance is different, to sit and have a conversation with a person to actually learn who the person are, it helps us to be less biased because we learn. The biggest thing too, and I want to say this, let's just go through this one. Cultural healing and practices, and then I'm gonna say what I'm gonna say. Different cultures have their own healing methods, spiritual practices, rituals, community support, etc. It's important to recognize and respect that these practices, and when it's possible, should be incorporated into treatment. Okay, so I said that to say this, is that in order for us to heal as a collective people, as in order for us to heal as a collective local body, in order for us to culturally heal as a country, we have to identify and accept that we are different. We have to identify and accept that we are different. And it's okay to be different. We should not take on the ownership of putting people in boxes and in categories. It's incumbent on us to work for the relationship of another. Why do I say that? I say that is because in order for you to truly know me, you're going to have to really get to know me. And that's going to take work. But if you don't want to know me, then know that that could be a barrier for us working together, uh, communicating, sitting down, having a personal or a business conversation, because it's all about building relationships. I can really chalk all of this up, generational trauma response, cultural sensitivity to building relationship. If we're to come together and we're to be sensitive to the culture, to our employees, to the people that are around us in our circles, and so on, is that we have to understand in order for us to build these relationships, we have to seek the individuality of a person. Everyone is different. No one is the same. No one has all of the same traits as another person. So as I'm getting close to the end now, I got probably about 2 or 3 more slides, but I want to give some examples of generational trauma in specific cultures. We have refugees communities. They often face trauma from like wars, displacements, and loss. Their trauma is compounded by cultural dislocation in new countries. We see this in previous last couple of years, is that a lot of people coming from these countries trying to get into our country are really struggling with the fact that they have to leave their home country. So there are very complex situations where they experience, and we have to understand. We have to be culturally sensitive to that. We have to really think about how do we communicate and communicate acceptance when we have people that are coming into our communities. I see a couple of statement questions, right? Let me see. What cultures, if any? So I'm asking a question for someone asked a question before I move on. It says, what cultures, if any, do you know that have a healthy response to trauma? No one. No, I don't know that anyone would have a healthy response to trauma. My statement to that is that we do the best we can with how we respond to things based on what we know and how we've experienced the trauma, and also based on how we've learned to deal with hardship, how we learn to deal with traumatic events, how we learn to approach difficult situations. Because a lot of times what happens is we really respond in how we are taught. And a lot of times people say, well, I wasn't taught how to deal with trauma. No, you wasn't taught how to deal with trauma, but what you have been taught is through experimental and seeing and witnessing how to deal with trauma. A family member deals with trauma, and you find yourself years later dealing with trauma the same way. So those things can be passed along as well. So that's kind of, so to answer your question, there's no specific way, or if any, as you say, uh, culture deal with trauma in a healthy way, and that trauma is not an easy thing to deal with. So we look at it from this point of view. Everyone that experiences trauma is traumatic. So there's no way you're going to initially deal with trauma in a healthy way because it's traumatic. But there's a period of time after the event happens that you can take a step back and learn how to work through it in a healthy way. Then the next question was, what are 2 coping tools that you think may be essential for generational trauma? I'm going to answer that. I got my next slide. I'm going to answer exactly that. What are 2 coping tools that you think might be essential for generational trauma? Hold that question. We're going to answer that. Okay. So healing from generational trauma. Here we go. So one of the things is first thing is we have to recognize that there's a need for healing. It's like this. Mostly everything or every problem or every challenge that we have, we must first acknowledge it. It's just like NA or AA. The first thing they have you to do is say, they have you to stand up or sit down and say, hey, I'm Kevin, and I'm an alcoholic. I'm Kevin and I'm a drug addict. Because if you can't admit first that there's a challenge or there's a problem, you cannot actually fix or you cannot manage the problem. You cannot even begin to work on the challenge of whatever that problem may be. So when it comes to generational trauma, we must first recognize that there needs to be healing. There are so many people that do not understand that their response to their everyday life is a direct effect or impact from their mother or their father or their grandparents. A lot of people don't understand that. So if I don't understand it, I can't recognize that. I won't recognize that. But you got to do the work first. You have to do the work to delve into why your behavior and why your approach to things are the way they are. And if you do the work, most of the time, you will see that there's some things that you did not develop on your own, that they come from a place. They come from a previous relationship or with your parents or your grandparents. So the first thing is to acknowledge, recognize that the healing that you need to be healed. Then, then the second thing is there are therapeutic approaches. When we recognize how trauma-informed care and cultural competency therapy can help individuals, it can help us heal. So that you find yourself talking with a clinician and you find answers and different approaches to that from through clinicians. And we'll talk about that on our next slide. And then thirdly is build resilience. You know, we have to make sure that we're building people up. We're encouraging. We going to therapy, going to counseling groups, uh, meeting in social aspects, meeting in your religious establishments and whatever, if that's your belief. And so those type of things, how you build resilience by building support system. So practical strategies. Here we go. So cultural competency training, that's what we're doing. Build cultural knowledge. Also cultural relevance assessment tools. Those are things. Collaborate with community leaders and provide language support. So all of these things are practical strategies for cultural sensitivity and trauma. And when it comes to generational trauma, going back to the question that was posed, is that when you find out and when you stumble upon the fact that you're approaching life and dealing with life from a standpoint of something that has happened to someone before you, a mother, a father, or a grandparent, understand that that's not yours. That's not your trauma to carry. That's not your responsibility to carry their trauma. Now, here's the thing about that is that most people, if you recognize that you have a trauma and if you see it in someone else, it should prompt you to act. It should prompt you to have a conversation of how you've influenced their life with your trauma, and then now how they're now displaying their trauma as their own. So recognition when it comes to your trauma, first thing is to recognize. The second thing is to give yourself some grace. Give yourself some grace. Give yourself room to explore and grow. Give yourself room to explore and grow in the fact of how I address things, how I approach things, how I can do it differently. I can I can do things like set up a support system for myself to where if I have something that I want to talk about that I really don't identify or understand, I have someone I can go to and talk to and not feel judged or criticized. It is important to create a safe environment and people that are around you that can keep you safe as well. And so just because you have an idea or you feel some type of way about your trauma doesn't mean that you can't talk about it, but you have to make sure that you're talking about it with the right person that could help you navigate that. Someone that is not going to criticize or judge you of your thoughts and how you feel about your trauma. And then the third thing I would say is seek professional help. have them to walk through that process and go through that journey with you to where you don't feel alone, to where you don't feel left to your own interpretation of what you may be thinking or feeling. And so that's one thing, that's a third thing that you can do, is to make sure that you're having that right support system, and that therapeutic that professional therapist, or that professional social worker, or whomever that can help you with that process. And then I would say the last thing is what's very important, is a being in a community and a society that supports you. Being in a community and a society that supports you. Do you know that you can live in a culture, within a culture, and still not feel supported? And that doesn't necessarily mean that that's your identified race or identified environment. That doesn't mean that. That means that I have people in my community that supports mental health, that supports therapeutic approaches, that support building up community in a sense of a social acceptable environment, and a mental health acceptable environment as well. So so I said that, and I have 4 minutes, and um, I didn't have time to go over this, but recognizing personal biases, and then avoiding cultural stereotypes, and addressing the limited access to resources. Those are the challenges that we have to overcome. So tools for self-reflection and growth, cultural humility, we talked about that. Seek feedback, and cultural consultation. It's okay to ask someone, did I say that right? Did I offend that person, or did I offend you when I said X, Y, and Z? Being able to have that cultural humility. Humility is going to take us a long way when it comes to culture, because we don't know. And it's okay to say you don't know. So in conclusion, cultural sensitivity is vital to trauma care. By understanding and respecting cultural differences, healthcare providers can offer more effective, compassionate, and holistic care. You have to identify with someone that will treat the whole person, not just one section or one part of a person. Okay. And then there's a call that next step is integrate cultural sensitivity and practices. And then the call to action is to educate yourself, challenge your biases, and foster inclusivity in your communities, in your work situations, in your personal life. Always look to educate yourself, challenge your biases, and foster inclusivity. So that is the end. Any questions? I don't have but 2 minutes, but any questions?
Well, Kevin, excuse me, Dr. Thomas, I don't want to be too familiar. Um, there was one question that was put in at the beginning, and it really kind of, I think, was answered on slide number 7. It says, what are common physical disabilities that can be caused by CPTSD in the nervous system? So I guess the difference
Can you ask
between,
that question again? I didn't hear that. Go ahead.
yeah, what are some common disabilities that can be caused by CPTSD? So complex post-traumatic stress disorder in the nervous system.
Okay. So some of this. So one of the things is, so we talked about she said complex PTSD, correct?
Right.
So we do know that PTSD uh can be, again, one event, one whole traumatic event. It could be an act of war, it could be an accident, a car accident. And now when we talk about complex PTSD, again, it could be multiple things that causes constant intrusive thoughts, constant flashbacks, replaying of the events, all those things. But the disability part of it is, disability is not physical in a vacuum, right? Disability could be mental debilitating, could be physical, could be emotional debilitating. So in essence, what I'm saying is that these disabilities can cause a person to confine themselves to their home. That could be debilitating. It could also cause a person to not want to be in certain areas. So these can be disabilities, but if we want to talk about physical disabilities, they can cause hypertension, they can cause diabetes, they can cause I don't know if people understand what gout is. All these things can cause a lot of stressful, debilitating things that also can feed to the body and have more physiological implications as well to that. So,
Yes, and also to address this other question, thank you so much for that response. Um, will you be able to provide us a copy of the slides that you presented?
so I will be able to provide you the slides. Here's my disclaimer that I always give people when I'm sending out slides, because it's an intellectual property, but also because I don't want anyone to go out trying to teach something that they have not, been qualified to do. So if you want it for your own personal preferences, by all means, but I would caution them to not teach it. So
Understood.
that's kind of how I feel about that, and that's
I'm
not a
very
problem.
glad. I'm glad that you put that note of caution in there. So yes, if you could provide us a PDF of those slides, we will uh, be able to share those. But we also have the recording of this webinar, and that will be on our YouTube page for people who might not have been able to participate live. So I know to respect people's time, I want to thank you, Dr. Kevin Thomas, and we will have contact information that we can share that we can also put on our webpage. Would that be all right if we have ways for people to contact you, Dr. Thomas?
Absolutely.
All right. Well, thank you once again, everyone. We've got some thank yous on the question and answer as well. So um, please watch our webpage, www.naminorthernillinois.org, for future uh, Leading the Conversation podcast. Thank you, Dr. Thomas.
Thank you.